When I had the first gastric bypass surgery, it was in January of 2004. I was noticing I was making a whole plate and finishing that whole plate. And I knew that wasn't right because the surgery is designed for you to eat smaller portions. I got on the scale and the scale read 290 pounds. And I was like, where did this come from when I know I was smaller than that before?
Latonya was a patient who had a previous gastric bypass, and that's a situation in which either she didn't get enough weight loss to start with or got a significant amount of weight loss and then regained the weight. It certainly is a complex problem, and I think a lot of patients are hesitant to come back because they feel like they're a failure.
When I had ballooned back up to that 290, I knew something wasn't right with the initial procedure. So I had to get some answers. I had to get a resolution for what was the cause of the weight gain.
Sometimes the problem is that the operation was not done optimally to start with. Sometimes it's a behavior problem or not following the rules. And sometimes it can be something that causes a big change in life, a death in the family, pregnancy, something like that can get a patient off track. Regardless what the reason is, if they're morbidly obese, they're at risk. I think it's not ethical to withhold treatment from those patients just because they had a previous procedure. In Latonya's case, we revised her gastric bypass, and that certainly takes on a bigger responsibility for the patient because we are doing something that's more aggressive than they had the first time because it is no longer working or didn't work to start with.
I'm very happy with my results. This time around, I did lose more weight than I did from the first surgery. For someone who is frustrated about weight gain after weight loss procedure, I will let them know there is hope. That don't give up. You have a second chance.